Hi, I'm Dr. Peter Bayich, the Director of Men's Health at the Cleveland Clinic Glickman Urological Institute in Cleveland, Ohio.
And I'm Dr. Revati Bole, and I'm a urologist and fellowship-trained men's health specialist at the Cleveland Clinic.
As men's health specialists, one of the things we focus on is treating men's sexual health, specifically erectile dysfunction, or ED. So let's talk about the most common treatment options for men who have difficulty getting or maintaining a hard erection.
Most men experiencing ED will first try pills before having sex, like sildenafil, which is generically called Viagra, or tadalafil, which is generically called Cialis. But some men prefer to avoid taking pills, and there's nothing wrong with that. So when pills aren't the answer, there are three other options. The first is a vacuum erection device. This is an external device that slides over the penis and pulls blood in. A tight rubber band is then placed at the base of the penis to maintain the erection. Another option is an injection into the penis using a needle and syringe. The medication in these injections is specially compounded and has to be injected into the penis 10 minutes before sex. But with these first two approaches, there are some drawbacks. Both reduce the spontaneity of sex, and many men don't want to inject into the penis. So what can we recommend for men looking for a permanent and spontaneous solution to ED? That brings us to the third option, a minimally invasive penile implant.
A minimally invasive penile implant, or penile prosthesis, is a procedure meant to give you the ability to have an erection whenever you want, and for however long you want. The penile implant is an outpatient procedure done under anesthesia, and it usually takes about 30 to 60 minutes to perform. Once you're asleep, a small opening is made in the skin, either an inch above the penis or on the front of the scrotal sac. A completely internal and concealed device is placed inside the penis that you control by squeezing a small pump hidden between the testicles underneath the skin. As you squeeze the pump, two balloons or cylinders inside the penis fill up with liquid. It's similar to an inner tube in a bicycle tire. These cylinders fill the space in the penis that normally fills with blood during a natural erection until the penis is completely hard. You can then have an erection for as long as you want without having to worry about losing it. When you want the erection to go down, you squeeze a small release valve hidden above the pump, and the device will deflate. The fluid is then stored in a balloon hidden behind your belly muscles until next time you want to use the device. Men undergoing the penile implant procedure typically go home the same day and are ready to have sex in about 4 weeks. About 25,000 men in the United States go through this procedure every year, and over 90% of them and their partners are satisfied with the results. Insurance coverage for the procedure is excellent, and it's covered by Medicare and most Medicaid plans.
It's very important to know that penile implants do not change the sensation in your penis, your orgasm, ejaculation, or the way that you urinate. The best candidate for a penile implant is someone who can't get a hard enough erection, or someone who loses his erection too quickly before reaching climax, but wants to be able to get an erection whenever he wants. You don't have to try injections or the vacuum device before talking to your men's health urologist about an implant.
Penile implants are minimally invasive, but like any surgery, there are some risks. The most important risk is implant infection. Thankfully, these are rare, affecting about 2% of men undergoing this procedure. To prevent infection, antibiotics are given before, during, and after to help reduce that chance. Diabetics and men with weakened immune systems have a slightly higher risk of infection, about 5%. Another risk is the device breaking or wearing out. Thankfully, the average device lasts for about 20 years before it stops getting hard, and it can always be replaced with a new one if needed.
If you're considering a penile implant, take charge of your health and schedule an appointment with a Cleveland Clinic urologist.
We're here to help.